From KVOA, investigating for you, this is News 4 Tucson, live at 10.
Good evening, everybody, and thanks for joining us. I'm Sean Mooney. Monica Garcia has the night off. A state auditor general review says some long-term care facilities are still coming up short when it comes to meeting the needs of some of our most vulnerable Arizonans. This latest review comes more than 3 years after the auditor first recommended changes. News 4 Tucson's Eric Fink is live in our newsroom tonight with more on what's in this report. Eric.
So, Sean, this latest report shows under the direction of the Arizona Department of Health Services, long-term care facilities are making progress but still have a ways to go to ensure the health and safety and welfare of our most vulnerable neighbors. And one senior care advocate tonight says ADHS has to respond to complaints against these facilities in a more timely manner.
There's a lot of energy to make changes, so we are able to say that we're protecting our most vulnerable citizens.
Dana Kennedy is the director of AARP Arizona. The organization represents more than 900,000 Arizonans. A 3-year follow-up report just released by the Arizona Auditor General shows Arizona long-term care facilities must continue to do a better job protecting the welfare of its residents. Kennedy says ADHS must focus on ensuring more people are hired to inspect these facilities.
We advocated to get them additional funds so they could hire more inspectors, and they did get that allocation of resources, but unfortunately they've had a really difficult time hiring those inspectors. But that's absolutely critical. It needs to be a top priority.
In a response to the report on the Department of Health's website Friday, ADHS Assistant Director for Licensing and Policy Tom Salo says, quote, "The team stopped closing self-reports from facilities without an on-site inspection when required and implemented a new reprioritization policy. As a result of implementing that policy, the percentage of complaints reprioritized dropped from 42.1% in the first half of 2022 to 1.4% in the second half of the year." Kennedy says there can be a significant lag time in a critical area.
When somebody does file a report, the delay in somebody going out and actually seeing what's going on is really a problem.
AARP Arizona is also fighting for better oversight when it comes to assisted living facilities.
One of my concerns is that we have a licensing board that oversees our skilled nursing facilities. Our assisted living and smaller group homes, they hardly have enough regulations. So that's an area that we're doing a lot more research on.
Now, knowing that more staffing is essential to inspect long-term care facilities in our state, a couple of years ago, the legislature allocated $1.6 million to hire 16 more positions. But the state health department says it's had a hard time recruiting and retaining qualified people to take those jobs. Live in the newsroom tonight, I'm Eric Fink, News 4 Tucson.
Thank you, Eric.